the real challenge to people-powered health is ultimately not going to be building sensors and not going to be coming up with things to do with the information, but to integrate all the information. I think that's the big challenge at the moment, because it's sort of like designing an airport where if you have all the planes flying off without any regulation, control, interaction, there's obviously going to be catastrophe and chaos. Conversely, if things are well set up, if there's a cleverly devised integrated airport, then everything's going to go off in the right direction for the right individual, depending on where they're going. I once, said to my grandfather, may he rest in peace, Grandpa, not only am I going to have my whole record collection in my pocket, but also I'm going to be able to telephone you from my pocket. And he looked at me and he said, James, what are you talking about? And I think the level of transformation that digital health in all of its different facades and faces is going to bring us is as revolutionary as the cell phone has been to communication. The way we currently experience health care and health, whether that's through programs to improve our activity or nutrition, or whether that's going to the doctor's office to receive medical care, I think we cannot at this point even contemplate what a new world health order will look like. Because in that space, in my opinion, there's going to be data streaming off individuals, and it's not just going to be things, movement and jaw movement and eye movements. It's going to be biological variables are going to be streaming continuously into meta-computers that are going to be analysing this on the fly. The healthcare team isn't going to wait for you to come to the doctor's office once every 4 years, but is going to be pinging you signals with potential interventions, and some of those interventions are going to be also launched in a mobile fashion. For example, there are already mobile drug delivery devices that can be activated through a cell phone signal. And so this opportunity of delivering truly mobile healthcare whilst individuals never even visit healthcare professionals is part of the future. Inevitably, when something new occurs, where lots of activity is existing across the marketplace, across the consumer space, the inevitable response is, because we're only humans and we can't handle too much, is to regulate. Regulate, regulate, regulate. Control, control, control. Now, in an innovative space, what you actually want is minimum regulation and minimum control, because it's expensive and it slows things down. And so inevitably you need some kind of balance between those two forces. What is the critical word in that question, as I said, is the capitalization issue, because if you want to capitalize on a sort of a new way of looking at health, a new way of functioning in health, what you actually want is not to make the wall to enter too high. It needs to be easy entry. And so therefore, that regulatory environment needs to be minimalistic, not maximized. And so, to me, part of the trick to all of this is to maintain a low regulatory environment, a very high privacy environment, because those two things are not necessarily the same thing, but to provide, therefore, the impetus for many, many small and large entities to build into this space. Because what's going to happen is you're going to have thousands of builders, hundreds are going to fall aside, and the good things, the useful things, will keep going and increase. And I think, and that's sort of how I see the marketplace, but I think the big mistake is to over-regulate, because that's actually going to shut things down far more quickly than actually will be necessary to improve human health at the maximum speed.